Okay. Okay, everybody. Hello and welcome. Welcome, everybody, to this webinar that I am giving. My name is Eve. I am the host and creator of the podcast called Please Me. And Please Me, its aim is to destigmatize conversations about sex and sexual health. And the way I do that is by turning the sheets into our classroom. So I am so excited to be turning the sheets into our classroom this morning with you. And we're going to just do an interactive Q&A. And I'm going to be covering a few different topics. One of them is going to be erectile dysfunction and its treatment and prevention. I'm going to be covering nutritional tips and tricks to help get those erections even stronger. And I'm going to be covering different tips and tricks that you can do to also extend your erections, okay? And so there are some tips and tricks that you can learn to do to extend your erections. So I'm so excited to be here this morning. I am a licensed physical therapist. I treat conditions of the pelvic floor. And I also treat sexual health conditions. So I do treatment for erectile dysfunction, and it's called acoustic wave therapy. And acoustic wave therapy has been around for a while. It has been used for a lot of different things. Portugal. Okay, exciting. I am so excited to be talking to several different places. So let me just explain. I'm on live, and I'm on live on YouTube. I'm on live on Instagram, and I'm on live on Facebook, and I'm also live on SDC.com. SDC.com is a website. It's a dating website. It's also a source for different educational webinars such as this one. And it is a source for articles and information regarding alternative lifestyles. So if you are interested in looking into that, I have people from Holland, I have people from Spain, I have people from Miami, I have people from Portugal listening this morning. And I'm so excited to have all you people from Europe listening. And India. Okay, namaste from India. This is so exciting to have people from really all over the world listening to this topic. And it is a global issue. And a lot of it has to do with what we eat, unfortunately. So just as a side note here, my podcast was rated number 2 in Portugal last week. And that is so exciting for me because I really would love this podcast to be global. And so please, support the show, listen to the show, tell your friends about the show. If you haven't listened to the show, you can listen to it on SDC. It's under my media content. And you can listen to it anywhere you listen to podcasts, on Apple, Spotify, Audible, etc. And you can also watch my podcasts because I do also do video format, and I do them on my website, pleaseme.online, so you can find them there. You can also find my videos on my YouTube channel. All of my podcasts and my video podcasts are on my YouTube channel. So let's get into the nitty-gritty of the topic today. So I do a treatment called acoustic wave therapy for erectile dysfunction. And the purpose of that therapy is to break apart any kind of blockages that you might have in your blood vessels. So as we get older, we develop blockages in our blood vessels due to what we eat. And it's typically due to cholesterol building up in your blood vessels. And, if that goes on and on, it can create blockages in your heart and it can cause heart disease. So knowing what your cholesterol levels are is extremely important. And erectile dysfunction is actually a precursor to heart disease. So if you are experiencing any kind of erectile dysfunction, you really should go see your cardiologist to make sure that your heart is healthy, because issues with your erectile function can be a warning sign for heart disease and for a potential heart attack. So you really want to make sure that if you're having any issues with erectile function, that you are being followed by a doctor and you find out what's going on with your heart. A lot of times doctors will just prescribe the little blue pill, they'll give you Viagra or they'll give you Cialis. And what the function of that medication is it opens up the blood vessels so that more blood can flow through your blood vessels. So what happens over time, though, if you're having issues, is that no matter what happens with the extension of those blood vessels, if it's so blocked up inside, no blood is going to flow. So if you've been taking Cialis or Viagra for several years and it was working initially, but is no longer working now, that's because your blockages have completely blocked the blood vessels and it's not allowing the blood to flow. So what the treatment, acoustic wave therapy, does, and it's also called Gainswave, you can look it up, and it really is the gold standard in erectile dysfunction treatment. What it does is it breaks up those blockages in the blood vessels and allows the blood to flow more freely. Also, what it does over time, and so I recommend several treatments, okay? And I'll cover that in a minute. But what it does over time is not only is it breaking apart those little blood vessels, it's also creating more capillary formation. And if you know what a capillary is, it is the tiny little blood vessels that are everywhere in your body. And so this treatment not just breaks apart the blockages and allows them to flow through and out of your body, it also creates more capillary formation. And creating more capillary formation is going to create more blood flow. And when you have more blood flow to your penis or your clitoris, okay, because the clitoris is the woman's equivalent of the penis, when you have more blood flow to these areas, you're going to have a harder erection, okay, a bigger erection, because the penis is going to completely fill, okay? And that's what you want. You want to be able to get hard and you want to be able to stay hard, okay? So that is the treatment that I do. And I will be talking about this in a little bit, but I will be offering a special, and I'm showing it on my my other streams. I'm not showing it here, but I'm going to tell you what it is on SDC. There's going to be a special for anybody who's interested in getting treatments. I'm offering 5, get 5, and the sixth one is free. Okay, and so that's a $350 savings. And so you're going to be getting a package of 6 treatments. And why that number is significant and why I made this the special is because 6 treatments is the amount of treatments that I recommend if you're doing this for prevention. Okay, if you have no other issues and your penis is functioning properly, you're able to get erections, but you want to turbo boost your erections, you want to make them extra hard, and you want to create more blood flow, then I recommend 6 visits in order to really maximize that blood flow and prevent any future issues. Now, if you wanted to get more treatments, because you have, mild, moderate, or severe erectile dysfunction, then we would talk about how many more visits you would need in order to really maximize the treatment. But 6 visits is what I recommend as a baseline to help prevention and to increase the blood flow to your penis. So I'm going to stop right here. Oh, there's somebody from Holland. Hello, good morning from Holland. I don't know what time it is over there, but I know it's not morning. Here, I'm in Florida in the United States, and it is 10 a.m. And so I'm going to be talking about all of these fun topics this morning. So I have a couple of questions that people have posed to me. And like I said, I'm on multiple sites right now. So some people were able to pose these questions to me prior to the webinar. So I'm going to jump into these questions because I think they're good ones. And I think that everyone would definitely benefit from listening to these questions. So the first one is, can medications be combined to provide a greater response, or is that overkill? So example, Viagra or Cialis. And then they also asked me the maximum dose. Okay. So yes, you can use these medications to help you to get hard. But keep in mind that if you need medication, you already have erectile dysfunction. And the medication does not treat erectile dysfunction. It allows your erections to become hard for a time, but it doesn't treat the condition. Okay, it just masks it. It covers it up. It puts a Band-Aid on it. All right. So we don't really want to rely on these medications alone. Okay. First of all, if you take the medication, it opens up the blood vessels in your whole body, not just your penis. Okay. So if you have a blood clot or something going on in your body, you have heart disease, you have plaque in your arteries, it can cause you actually to release that blood clot and it to enter your heart, and you can have a heart attack. So it is not safe to take these medications all of the time. And keep in mind that if you need these medications, you should be seeing a cardiologist to make sure that your heart is okay, and that you are taking care of any cholesterol issues that you may have. So my recommendation, okay, is not to take Cialis and Viagra, okay? It is to treat the actual cause of the problem, which is blockages in your blood vessels. So that is my recommendation. Now, on SDC, like I said, it's an alternative lifestyle website, and it is for the ethical non-monogamous population. There's swingers and all sorts of wonderfully open-minded people on there, and they tend to have more sexual activity. So I know that a lot of people, when going to, a swingers club possibly, or a swingers party, or something where the performance is going to be of the utmost importance, some people will pop a pill. Okay. I think it's better to train your body to be able to extend your erections as opposed to relying on a pill. Now, that is my personal opinion. Everybody is going to do their own thing, but safety wise, and your health is the most important thing to really take care of. I think that treating it with the gold standard treatment, which I'm talking about right now, which is acoustic wave therapy, and also learning these tips and tricks is going to help you to be able to keep that erection for longer. So let me go into the next question. And then somebody asked me about the maximum dosage of Viagra and Cialis. I am not a medical doctor, so I could not tell you what the dosages would be. You would have to discuss that with your doctor. But keep in mind that if you've been taking Cialis or Viagra for a while and you are having a diminished effect from it, or it stops working altogether, that means that you really need to go see a cardiologist as soon as possible. So keep that in mind, because we really want to safeguard our health, and our health is the most important thing, really. Without health, you know, health is wealth, right? So I just wanted to mention that. I'm going to take this off here. And so the next question was, about group play, okay? And we're talking about, you know, swinging or people having multiple partners and having a play session, okay? And the question was, you know, in those types of situations, especially the first or second time, you know, that can cause men to not be able to perform. And I really, you know, there's multiple things that go into having a hard erection, okay? And what you want is for it to be as hard as freezer meat, right? You don't want it to be soft. So multiple things go into having a hard erection. One of them is your physical function, okay? And that's what that treatment that I just talked about focuses on. But then there's the biggest sex organ in our bodies, which is our brain, right? And our brain has to be in the moment in order to be ready for sexual activity. If your brain is not in the moment, if your brain is not, you know, ready to have a sexual experience, if you're feeling nervous, if you're feeling anxious, if you're worried about your performance, all of those things can affect your erectile function too, because there is the brain penis connection, right? Your brain is connected to your penis by all of the nerves in your body. And you need to be able to make that connection and say, yes, I am ready for your penis to, you know, perform. So making sure that you haven't drank too much, you know, are not filled with drugs, because your body needs to be able to be healthy in order to perform normally. Drinking is one of those things that will also make your penis soft. So you have to be really careful with that. I mean, I've heard that some people like to drink because it keeps them harder for longer. That is not a healthy way to be. If you have to numb yourself so much that you know, need to numb yourself basically by completely being inebriated so that you can last longer, maybe you should try some tips and tricks instead of causing damage to your body, because drinking that amount of alcohol is not necessarily the most healthy. I'm not saying don't have a glass of champagne or two, you know, get yourself in the mood, but over drinking is, number one, not going to allow for enthusiastic consent. And we always want enthusiastic consent when we're, you know, in any type of sexual activity from both partners or from all partners. And it's also not going to allow you to, you know, perform at your maximum capacity. So now we're going to jump into Boca Raton. Hello. I'm just saying hello to some people. Brussels. Oh, lovely. I mentioned earlier that, and I have a lot of Europeans on here today, so this is wonderful. So I mentioned earlier that my podcast, which is called Please Me, it's a podcast that talks about sexual health, and it aims to destigmatize conversations about sex. And it was number 2 in Portugal last week. So that is so exciting to me. And I'm so happy to see lots of Europeans on today. Please go listen to the podcast after you have, you know, gotten off this webinar. And so thank you so much. I appreciate that. They're congratulating me over here. So I'm going to continue. Now we're going to go into some nutritional tips and tricks. Okay. So let's just talk about everyday health. So on average, women and men should have, on average, about 10 servings of fruits and vegetables per day. Okay, and a serving is going to depend on your body size. So everybody's body is different. So your serving is more or less the size of your fist. So my fist is going to be a little bit smaller than some people's fist is going to be bigger than mine, or some people's will be even smaller than mine. So that is your gauge, 10 servings of fruits and vegetables per day. Now, I know that the average American has about 1.5 servings of fruits and vegetables per day. It's really, really terrible. We have a very calorie dense diet in this country, but a very nutritionally poor diet in this country. So eating more fruits and vegetables is so important, okay? And I can offer you an easy button for that. I talk about, and I am a representative for a company that sells a supplement that is essentially fruits and vegetables that have been encapsulated, okay? So what that does is it bridges the gap between what you should eat and what you do eat. So if you're eating 5 fruits and vegetables a day, well, good for you, you're above average, right? But to bridge the gap between that 5 and the 10 that you really need, this supplement helps you to do that. So in order to find that supplement, you can go to my website, and it is pleaseme.online. And I'm just popping it on here on my webinar so you can see it here. And it is pleaseme.online, and there you can find all of the supplements that I'm talking about. The specific ones that I'm talking about are the fruit, the vegetable, and the berry supplements. And when you take those 3 supplements together, okay, they're called the trio, you will get nutritionally 30 fruits and vegetables in your body every single day. And I do not live without those. I never miss my dose of Juice Plus is what it's called. Excuse me. Please don't go to juiceplus.com and buy your supplements directly through them. Please go to pleaseme.online and go to my site and buy your supplements through them because I will then get credit for telling you about it. So I would appreciate if you did that. But Juice Plus is an incredible supplement. It's been proven to decrease inflammation in your body. And inflammation is the biggest cause of every disease. It's a precursor to every single disease. So if you are decreasing the inflammation in your body, you're going to have much better health. And your penis depends on your overall health. So that's one thing that I recommend. The second thing that I recommend is watermelon. And I'm going to tell you why. Okay, hold on just a second. Let me have a sip of my coffee because my throat's getting dry. So there is a chemical, and it's a natural chemical. It's called citrulline, and it is in watermelon. Now, watermelon has citrulline, and if you take larger portions of it, this can help you with your erectile function. So I recommend that you try the watermelon challenge. That's what I call it. Okay. And it's a week of eating watermelon every single day. And if you try this, you are going to see that it causes your erections to be much harder. You're going to start seeing morning wood more often. You're going to start seeing random erections throughout the day. You're going to see an increase in your erectile function overnight. Keep in mind that you should be getting erections throughout the night. A lot of times when people have erectile dysfunction, those normal, natural daily erections that come and go throughout the day and throughout the night start to diminish, and they disappear Also, the morning wood. The morning wood is so important. If you don't have morning wood anymore, that is a sign that you're starting to have erectile dysfunction issues. And let me just go over the prevalence of erectile dysfunction, okay? 20% of men in their 20s have some form of erectile dysfunction already. When you go to your 30s, it's 30%. When you go to your 40s, it's 40%. When you go to your 50s, it's 50%. On and on, it goes up 10% per decade. And it is extremely, extremely common. And not only is it so common, it's barely ever talked about, which is a reason why I have my podcast, because I feel like people are not talking about these things. And so they're not getting help that they really need. And, why do we go to the doctor for, a broken knee or a broken bone, but we don't focus on our sexual health? I think our sexual health is so important to focus on. I'm sure that if you're listening to this, you do agree that, sexual health is super important. It brings us happiness. Sex is the way that adults play. And so it is our playground. And you really need to have maximum function in order to enjoy that playground, right? So the watermelon challenge, let's talk about that for a minute, okay? So the watermelon challenge is, now if you're there's two types of watermelon, and I don't know if you're familiar with that or not, but there's yellow watermelon, which has 4 times the amounts of citrulline, and then you have the red watermelon, which has less citrulline. So if you're going to have the red watermelon, which is easier to find, I hardly ever find the yellow one. I recommend that you have 4 cups of the red watermelon per day for a week. Okay. Now, if you have the yellow watermelon, if you're able to find the yellow watermelon, then you can just have 1 cup of the yellow watermelon per day per week, okay, or that week, okay? And if you try this watermelon challenge, please reach out to me afterwards and tell me what your results are, because I love to hear the changes that people make, that people have in order to, the benefits from just making a small change in your nutrition. Okay, so all fruits and vegetables are good for your circulation. And we're talking about circulation here. This is what's going to help you to help your function of your erections. So lots and lots of fruits and vegetables, and specifically watermelon. Try the watermelon challenge. Is anybody going to try it? Yes. Elliot's trying it. Okay. Someone's eating some watermelon right now. I love it. Okay, so fantastic. Berries are also really good for your function. They help to decrease the I'm blanking on a word right now, but they're really good they're antioxidants. So they help to decrease the oxidation in your body. That's what I was going to say. So, so lots of berries is really good. And I super recommend the Juice Plus berries for that. Because, your body needs that in order to be healthy internally. And it's going to help every single cell in your body to be healthier. Pineapple is great too. And I'm going to mention pineapple here because pineapple also changes the flavor of your cum or your semen, your ejaculate. Okay, so eating pineapple is also gonna, help you to taste even yummier in the bedroom. Okay, and that's the case for women as well. So when you eat lots of sweet fruits, that helps you to have more of a sweet flavor. Okay. And who doesn't want to taste delicious, right? Yes. Right. That's right. Okay. So we've talked about nutrition. We've talked about the treatment for erectile dysfunction. I'm going to go into another question now. Okay. Yeah. Okay. Any other questions here? Um, I'm just looking to see if we have any questions here. The treatment is called acoustic wave therapy. So it's not radio waves, but it is sound waves. So acoustic waves. It's kind of like little shocks. So you're giving your body little tiny shocks that break apart the blockages in the blood vessels. This has been used to, it was originally a treatment, a technology that was developed for breaking up stones in your kidneys. And, you know, they noticed that it helped with circulation. And it was also used, and it is also used to treat problems of, you know, different joints. It helps to increase circulation to different joints. So if you have like a knee replacement, or you had knee surgery, or you have a bad knee, let's just, you know, keep it general, right? And you get this treatment on your knee, it's going to increase blood flow to the area. And what blood flow does is it helps bring the nutrition in that your body needs to heal itself. And then it helps to cart away the toxins that are left behind, all of the pain chemicals and all of those things that are left behind. It helps to cart them away. So increasing your circulation is good for your joints. If you have some kind of ligamentous issue, or you have joint issues. So acoustic wave therapy is actually used for quite a lot of things. I use it in my physical therapy practice to treat the elbows, to treat the knees, to treat the shoulders. It helps with range of motion. I had a patient who couldn't, they had a car accident and they couldn't turn their neck. And so I used it on their traps, and suddenly they were able to move their neck. I used it on another patient who had a lot of swelling on their knee, and it helped to increase the circulation to the knee to help decrease that swelling and to decrease pain. So there's a lot of different uses for for acoustic wave therapy. It's also called quote unquote shock wave therapy. It's a very loud treatment because it's causing little tiny shocks to go into your tissue. But it is extremely effective, and it is the gold standard for erectile dysfunction treatment, and also the gold standard for making sure that you stay healthy and you prevent erectile dysfunction. So let me just check my notes here because I want to make sure that, okay, so let's talk about controlling how fast you come, right? Or you ejaculate. So, you know, a lot of times when people don't have a lot of practice, right, they ejaculate very quickly. And also premature ejaculation, which is ejaculating sooner than a minute, like a minute or less, is actually a precursor to erectile dysfunction. So if you notice that you are having more issues with premature ejaculation, where you're ejaculating really quickly, that is a sign, one of the signs of erectile dysfunction. So, so most men, okay, when they are, you know, masturbating, can masturbate and come to they can come in with around 5 to 7, well, maybe like 4 to 5 minutes, right? And actually, it's around the same for women too. So when women masturbate and men masturbate, it takes around the same amount of time to get to climax. Then it changes when we come to penetrative sex, right? So during penetrative sex, it takes men between 5 to 7 minutes in order to ejaculate. And for women, it takes women over 25 minutes to reach climax in penetrative sex. Now, and some women will never reach orgasm in penetrative sex because only 3 to 5% of women can reach climax from penetration alone. 95% of women need clitoral stimulation in order to climax. So, really focusing on that external vulva and clitoris with touching and maybe oral sex or maybe using a vibrator is going to help your partner to reach climax. And I talk about this so much on my podcast because it's such an important topic. And a lot of people don't really understand that men and women are just different physically. It takes a woman much longer to climax than it does a man. And women don't typically climax from penetration alone. Only 3 to 5% of women can. So that is why there is a very big prevalence of women who fake it. And we don't want to fake it. Okay, we want to be honest with our partners, because if we're faking it, we are teaching our partners that what they're doing currently is what you want them to repeat. Okay, because they're getting that, satisfaction of knowing that they got you there when they really didn't. So don't train your partner to do the things you don't like. You need to open your mouth and you need to talk to your partner. Now, this week, actually this morning, I had on my podcast was released this morning, season 2, episode 13. And I had a guest on. Her name is Marina Pearson. And she was brought up in the UK, but she's actually half Spanish. So she lives in Spain. And she was a wonderful guest. And she talked about being a people pleaser. And, if you're always people pleasing, you are not focusing on your own pleasure. So she talks a lot about going from a people-pleasing mentality to going to, a pleasure mentality where she is experiencing pleasure herself. And it took her many years to figure this out. And so we want to speed that up for all of us, right? So be sure to go back and listen to today's episode. It's an amazing, amazing episode. So let's talk more about semen, controlling your semen, right? So a lot of times, if you want to extend your erections for longer, okay, so that you can have longer fun playtime, and that's what we all want, right? It's good to masturbate actually after you have sex, okay? So after you finish having sex, maybe an hour or two later, it's good to masturbate in order to desensitize yourself a bit, okay? Also, wearing a thicker condom will also help you to desensitize your penis somewhat in order to extend that playtime more. Okay. And if you're able to extend that playtime more, you may be able to extend it long enough to really get your partner to get there as well. Okay. Because if it only takes a man 5 to 7 minutes and it takes a woman 25 minutes or more, there's a huge gap. And that's called the orgasm gap. And I am bringing awareness to this gap because it is a big problem. And in heterosexual relationships, women have the least amount of orgasms out of any other type of relationship, whether it be gay or even self-pleasuring. Self-pleasuring single women have more orgasms than heterosexual women, okay, in heterosexual relationships. And that to me is very sad. And I am bringing awareness to the orgasm gap and I have started an orgasm revolution, which you can look at my website and learn about and join if you'd like. And the reason I started this orgasm revolution is to bring awareness to the orgasm gap. It is such an issue. And we all need to be aware of it so that we can close that orgasm gap for our partners and for ourselves. If there's ladies listening right now, one person at a time. You really need to focus on your pleasure and what gets you there. So I definitely recommend you going to pleaseme.online and looking at how to join the orgasm revolution. And it is really, I think in an important topic to talk about because, on the whole, I will say that men typically do want to please their partners. Yes, wouldn't you agree? Out there from Spain and Holland and Boca Raton and Miami and everywhere else you guys are joining from, don't you agree, that you want to please your partner? And it is very pleasurable to bring pleasure to your partner on both sides. So, thinking about that is really important. So another tip that you can take is taking deep breaths. And when you take deep breaths, it shuts down the ejaculatory response. So on one of the episodes that I spoke with Nate Zeleznik, okay, and I'm just popping it up here. We come into the world with an inhale and we go out with an exhale. And so really to completely oxygenate our blood, the best breathing exercise that you can do is 5.5 seconds in and 5.5 seconds out. And if you do that prior to having sex, you're going to really oxygenate your blood and allow that blood to be fully oxygenated so that it can flow to your penis and your vulva and your clitoris so that you can have better orgasms. So those are some of the tips and tricks that you can use to extend that hard on. Okay, that. Why am I getting pop-ups here? Okay. That's right. So masturbation is completely natural. I just had a question. Is masturbation bad for your health? And actually, masturbation is very good for your health. And for men, it is very, very good for your health. If you masturbate 22 times per month or more, okay, that is going to increase, it's going to decrease your prevalence of prostate cancer. So if you, like I said, masturbate almost daily, 22 times or more per month, it's going to decrease your risk of prostate cancer. So the answer is that masturbation is actually really good for your health. And I'm going to tell you why it's good also for women, okay? It's, first of all, women have something called the Skene's glands, and that is our version of our prostate. And we also ejaculate from that Skene's gland, okay? And we're going to talk about this in another webinar in a couple of weeks, and we're going to go into the female ejaculatory system and all of that. It's going to be a really great webinar as well. But we also have to masturbate as well to keep our health going as well. We have something called the Skene's gland that is equivalent to the prostate. And what's really important for women, and the reason why I recommend that women masturbate regularly, is because when you masturbate, you know what turns you on. You know what gets you there. Everybody's different, okay? But in order for you to be able to have success and close that orgasm gap in the bedroom, it's very, very important that you know what pleases you. And you can carry that information from masturbating solo to the bedroom, okay? So that you can tell your partner what's going to get you there so that they can help you, because your partners want to please you. Absolutely, yes. Indeed, absolutely, definitely. This is how all of the comments that I'm getting when I ask, do we want to please our partners? And everyone says yes, okay? So if you have a partner that doesn't want to please you and doesn't want you to bring your vibrator into the bedroom, and that, is not focused on your pleasure at all, they're only focused on their own pleasure, then maybe you need to consider, if that's the right partner for you, because they're being very selfish, and we all deserve pleasure. Okay. Men and women, no matter who you are, whether you are gay or you are bi or you are, trans, we all deserve love and pleasure. Prostate massage is actually, so that I just had another question. What about prostate massage, right? And prostate massage is actually very stimulating for the prostate, and I don't have a prostate, so I don't know, but it's supposed to feel really wonderful. So I encourage you to experiment. Everybody is going to be different. Everybody is going to gain pleasure in different ways. And just because you like one thing one year doesn't mean that you can't expand and like some different things the next year. And, as we get older, our sexuality, our sensation, all of those things change. So it's sort of like, an evolution, right, of sexuality that you're going to be exploring throughout your whole life. So try different things. Sexuality is really the spice of life. It's what gives us all pleasure and happiness, and it brings fulfillment into relationships. So definitely experiment. If you want to try a prostate massage, go for it. See if your partner will give you one. And if not, maybe get a toy that might be able to reach your prostate so that you can give yourself a prostate massage. I think it's a great idea, and I definitely recommend that you experiment with that and with lots of other things, okay? So let me just see if there's any other questions here. Okay, so there's another question here posed about cock rings. So cock rings, the point of a cock ring, right, is to hold the blood in the penis so that it stays hard for longer. So cock rings are a really great tool to help you to keep your erections for longer times. I recommend them for sure. I also recommend penis pumps. Okay, and I usually will recommend penis pumps in combination with erectile function treatment, with acoustic wave treatment, because what you're doing is you are creating more blood flow, you're breaking up the blockages, and then with the penis pump, you are forcing blood into those arteries so that you can really fully expand your penile tissue as much as possible. So penis pumps and cock rings are definitely recommended. They're all natural. They're not adding chemicals to your body. So I definitely say yes to cock rings, and I say yes to penis pumps. Okay. I'm looking at questions here. Okay, so the question here is, with regard to the recommendation of 22 days of masturbation, is that in addition or exchangeable with penetration? So if you are having wonderful sex, enjoyable sex often, that would count as, and you're ejaculating, that would count as an ejaculation for that day. Okay. So you can, if you're having sex, you can, and you're ejaculating, the point is you have to ejaculate, right? So if you're ejaculating and having sex, then I would count that. Now, if you are edging and you're not actually getting there, then I would not count that as one of your 22 to help with the prostate. Okay. So yes, it can, but you would have to ejaculate. So the question is, do you last longer if you have an uncircumcised penis? And I really have never heard this question before, so I'm going to have to look that up. But my guess is, if you have a circumcised penis, the head is exposed, right? If it's uncircumcised, the head is covered by the foreskin when it's soft. But when it's hard, it slides down and the head is now exposed. So the head is the most sensitive part of the penis. So if you're stimulating the head of the penis, it's going to be more sensitive. If it's always covered with the foreskin, it's going to be more sensitive than if it were circumcised. So will you last longer? That really is very individual. Some people with circumcised penises can go on and on and on, and some people with uncircumcised, penises, finish in 2 seconds. So that is a very individual thing. But I will look up and see, and I will post it in our chat, in our chat room on SDC to see if there's a different answer to that. But my guess, my educated guess, my professional guess is that, it doesn't matter whether you're circumcised or uncircumcised. What really matters is your experience. If you are having sex often or masturbating often, you're going to learn how to control that more than if you have never had sex before. Okay. So practice makes perfect. Okay. Any tips for the psychological side of ED? So diminish stress. Okay. I had a client who hadn't been able to have an erection since he was in his 40s, and he was in his mid 60s. And he was married to a woman all of this time who for whatever reason, mentally wasn't stimulating him. And he is now going through a divorce and has noticed that suddenly, where Cialis and Viagra was no longer working with her, suddenly now he's having spontaneous erections. And that is all right here. Okay. So eliminating negativity in your life is going to help you mentally. Eliminating stress in your life is going to help you. And doing those breathing exercises that I mentioned earlier prior to having sex is going to help to decrease your stress, and it's going to help to increase your circulation in your body. So breathing 5 seconds, 5.5 seconds in, 5.5 seconds out, and doing a round of that for maybe like 5 minutes. You can do that several times. You could do it while you're having sex. You should try not to hold your breath while you're having sex. You want to keep the breath going, okay? Keep the oxygen coming into your body and oxygenating your blood so that blood can be full of oxygen to go to all the parts of your body so that it can increase your sensation. Because what happens when you decrease, you have less circulation, is you're going to also have decreased sensation. And so for women, that's why we have decreased vaginal sensitivity and dryness, because our sensation or our circulation is not as good. So for men, it causes erectile dysfunction, and for women, it causes decreased vaginal sensitivity and dryness. When the blood flows to the vagina, it seeps in through the walls. The plasma of the blood seeps into the walls of the vagina and the vaginal canal, and that's what causes lubrication. So if you have a decrease in circulation, and we're going to talk about this in a couple of weeks for the next webinar, you're going to have decreased vaginal fluids, then it's going to cause dryness and decreased sensitivity, and also can cause pain then, right? And so I often talk on my podcast about lube, all right? And lube is for everybody. Doesn't matter if you're 20 or you're 80. Lube is for everybody. Because if you are having wonderful sex and you are having prolonged sex, right? There's only so much lubrication that a woman's body can produce. And now there's some women who, squirt and do lots of other things that, cause more lubrication down there. But for the most part, you want things to be sliding and to be slippery. Okay. So lubrication is going to be your best friend. So don't be shy and use lube. Don't be shy and use your toys too. Okay. Let's see. I'm going to look at some more questions over here. So any advice on how to reduce women's climax time? Okay, so that's interesting. And yes, stimulating the clitoris, stimulating the vulva, and keeping in mind that the clitoris is synonymous to the male's penis. And it's almost exactly the same size as the male's penis, but it's internal to our bodies as opposed to being external. So there are parts of the clitoris that are right underneath the vulva. And then you have, of course, the clitoris bulb itself and the clitoral hood, which is, the little piece of skin that covers kind of like the foreskin of the woman. All of that area is very sensitive. And so oral sex is really great to stimulate a woman prior to sex, because a woman also needs to get a hard on, believe it or not. People don't understand that, but women need to have a hard on too. Okay. We need to get engorged. That's what it's called in a woman. A woman needs to have engorged tissue in order to be ready for sex. And that includes everything, penetration and everything else. Okay. So getting that blood flow is very key. So some of the things that you can do to increase that would be to give your partner a vulva massage. All right. And I recommend that to really get that tissue engorged. Also, oral sex is wonderful as well to get that tissue engorged, but always keeping in mind that, if you are with a partner that you've agreed to, swap fluids with, and you are comfortable with that, that's fine. But keeping in mind that if you are playing with new partners, that oral sex is another way to transmit any kind of sexually transmitted infection. So you need to consider that if you're going to have oral sex. But the hand, is very easy to, rub and rub and rub. Okay. And typically a good 20-minute rub is going to get your partner to get much closer to climax, because if it takes a woman 25 minutes or more and you're giving them a good 20-minute rub, right? Or, 25 minutes of oral too, whatever you want to do, that's going to get your partner to be much closer to their climax. So those are a couple of different tricks for that. Let's just see if there's more questions. Okay. So the question is interesting. Is ball busting bad? And I'm assuming that you're talking about hitting your balls, right? And, for some men, they find that to be stimulating. And for some men, they find that to be excruciating. So really knowing who you are, what you like, and expressing that to your partner is so important. And so I say experiment. Is it going to cause issues? Well, if you're getting hit hard enough where you're causing bruising and that sort of thing, it can cause damage to the tissue. So, excuse me, considering that, if you like impact play, and, many people love impact play. I'm going to go into kinks just for 1 second, because it was a topic of a couple of different podcasts with Julieta Chiara, who is often on here talking about a lot of different things on SDC. She's a kink coach and a shibari expert, and we talk about kink. And 45% of Americans consider themselves kinky. So it's really very common, and many people love impact play. And impact play is just basically it's a BDSM term. And it is, spanking or hitting someone with, any kind of object, like whips or, anything else. And that is impact play. And many people enjoy it, and many men enjoy it in different places. And I think that this is what the question was about ball busting. Okay. So if you enjoy impact play, I don't think that there's anything wrong with it. Make sure that it's not causing tissue damage, because that would be a problem. All right. Let's talk about edging. That was another question that just came up. Is edging harmful for erectile function? So no, edging is actually a way to train yourself to last longer. Okay. So I encourage my clients to practice edging. All right. Because a lot of times, if premature ejaculation, like we said before, is a precursor to erectile dysfunction, and you're experiencing that, you need to diminish your sensitivity. And edging is a great way to do that. So you want to either masturbate to the point where you're about to climax, or you can also edge when you're having sex. So when you're feeling like the climax is coming, that's when you pull out and you take a break and you stop for a few minutes, and then you can resume. All right. And during that period of break, that doesn't mean that you can't, do other things like, stimulate your partner in a different way or whatever it may be. But edging is a great way to actually extend your ejaculation, or not your ejaculation, sorry. Extend your hard on. All right. So edging is actually good. Kegels are wonderful too. The pelvic floor is all interconnected with the penis. And so even though, everyone thinks of, Kegels as something that women do to help decrease incontinence, and there's a million different exercises that I teach my clients who have incontinence. But, a Kegel can be done in lots of different places, lots of different positions to help really strengthen the pelvic floor. And for men, the pelvic floor is very important as well. So Kegels are very good to do. And if you think about squeezing your anus, okay, that's one way to get that pelvic floor to contract. Also, if you think about lifting your penis up, okay, there's a muscle that does that too. And that also is attached to that pelvic floor. Okay, that's part of your pelvic floor. And so working on those muscles is really helpful as well. Okay, to keep everything strong, because, as we age, our muscles get weaker. So we have to keep that strength up. So yes, incorporating those exercises into your, everyday routine, when you're brushing your teeth or you're sitting in your car or whatever that may be, trying to add that to your everyday, because if you're just doing it once in a while when you remember, it's not going to be as effective as if you're doing it on a regular basis and strengthening those muscles. Okay, I'm going to take one more question because we are really out of time here. So you have, so the question is that he has trouble maintaining an erection with a condom, which is required in group play situations. So any tips? I would recommend that you get condoms that are very thin. They have ones that, are, very thin so that you can really feel more. And so before I was talking about wearing a thicker condom to decrease your sensation so that you could last longer, right? So that's a different reason to use a thicker condom. But if you have problems maintaining an erection because, you don't feel much, then I would find condoms that are for sensitivity, that you want to help to increase sensitivity. Okay. So last question, because this is an interesting one. If you're in a long-term relationship, is it better to masturbate without visual stimulation? I mean, that is completely, individual. So some people like to have visual stimulation when they're masturbating. It helps to get them to climax longer. If you're working on edging and you don't want to climax that quickly, because you're practicing trying to extend your, your hard on, then I would say don't use visual. But if you're just trying to get there and take a nap or go to sleep, then I would say use visual. It really just depends. And men are very visual. So if you're giving visual stimulation, that's going to potentially speed up the process for your partner. So, that, but it's completely individual. So, yes and no, right? So now I just want to mention that if you're interested in the acoustic wave treatments that I talked about earlier, I'm doing a special right now, and it is buy 5 and get 1 free. And so if you're interested in that and you want to set up an appointment with me, please reach out to me. You can go to pleaseme.online and you can reach out to me there. You can also reach me on SDC in my messages. So just send me a message there. And if you want to speak to me, I'm going to be on OWL for the next hour. And OWL is an app where you can ask an expert anything, right? And so I'm on OWL as a sexual health expert, and you can give me a call and we can chat. All right. So if you have any questions, you can reach me on the OWL app. You just have to download it onto your phone and use code EH576472. And let me just put that in here just so that you guys can have it. EH 576472. Okay. And plug that into the OWL app, and that will give you $10 free to be able to use the app. Okay. And so I hope that you guys all gained some really great information today. And, this topic can go on and on, right? It's just, we all want to have the best, very best health. Like I said, I have a podcast called Please Me. I would absolutely love it if you watched or listened to my podcast. The reason I do these webinars is, to bring awareness to my podcast. It's fairly new. I've only been doing it for about 8 or 9 months now. So it's fairly new. So it's getting the word out there. So please go and listen. And please go on to Apple Podcast or Spotify Podcast and leave me a 5-star review, because reviews are really what help to increase my viewership and also increase, where I am located in terms of viewing on each site. So it's really important to get those reviews. So, I've given you some of my time today. And if you could just take a few moments to listen to my podcast and give me a review, I would really greatly appreciate that so much. And again, if you want to speak to me, you can go to the OWL app. I've put the code in the notes, and add that, and you can give me a call today or really any day. I'm on the OWL app off and on. If you see that I'm not on at the moment, you can always leave me a request so that I turn my app on so that you can give me a call. And sometimes if I'm available, I'll be able to turn it on and you can give me a call when you request. Otherwise, we can set it up. Set up a call so you can message me or whatever, and we can set up a call and time. So you're very welcome. Thank you all for coming today and for listening to this webinar. And I hope that you're back in a couple of weeks to listen to the one about women's sexual health. Thanks for coming. Until next time.